Hello and welcome back. I'm Adam Rosen. Well, I hope that you've possibly found this video before your knee replacement. And unfortunately for a lot of people, you may have found this video after your knee replacement and you went searching for information because you've been having trouble sleeping. And that is an unfortunate common reality in a lot of patients that have had knee replacements. For some of my patients, it doesn't seem like that big of a deal. These are patients that may have to get up frequently at night to go to the bathroom, or patients that have had chronic night pain from their arthritis, and they're slowly, week by week, seeing an improvement. But for a lot of people that used to sleep through the night, and now you've had a knee replacement, and now you're waking up every single night, this is a rude awakening, pun intended. So why is that? Well, first off, it doesn't have anything to do with your bed. It typically doesn't have anything to do with the nighttime darkness. What it does have something to do with is the not moving. So when I'm talking to patients in the office, I say it's very similar that if I made you sit here and I left and let you sit there for 2 or 3 hours in that chair in one position, you would get uncomfortable, your knee would get uncomfortable, and you would have to move it. So when you go to sleep at night and you get into one of these positions and you do fall asleep, because you may have experienced, most of my patients will say, it's not a difficulty in falling asleep, it's that my knee then wakes me up from sleep. What happens is you haven't moved it in a while. So then it gets very stiff and it gets very achy. So there's a lot of options that I'm going to go over with you in the hopes that one or more of these options may help you, and it may help your knee pain, and it may help you sleep through the night, because sleep is very important. We need sleep to heal. We need sleep for a lot of other reasons, but especially when you're coming through a surgery and a recovery, you really need that sleep to help you heal. So I'm going to share with you a whole bunch of the options that I share with my patients, and hopefully you can find some of these things to help you get some sleep. Just understand, for most people, this is about a 6-week process. For some people it's shorter and they're lucky, and some people, the minority, don't get any night pain. But if you're one of these people that are having pain at night and your knee is waking you up a few times each night and you're having difficulty getting through the night and getting a good night's rest, just understand that you're not alone. It's common and it will go away. One of the things that I've seen with a lot of my patients is as they improve their range of motion and they get further along with their physical therapy, they tend to sleep better throughout the night. So just know that if in the first week or two it's stiff and it's achy and you're not doing very well with physical therapy, sometimes people think, I need to do less because it's maybe keeping me up. And my experience has been, if you push harder and if you get better range of motion, you might sleep a little bit better. The other important thing is making sure that your pain is controlled throughout the day. So we really try to avoid narcotics and excessive narcotics. And actually, narcotics may be a factor that may make it more difficult for you to sleep. But the idea of scheduled medication, so very commonly, me and a lot of people will use scheduled acetaminophen, which is also known as Tylenol. So you're taking it 3 times a day and you're keeping it in your system. And also some type of scheduled anti-inflammatory if it's not contraindicated, something like Celebrex or meloxicam, or an over-the-counter or other prescription form of ibuprofen, something like naproxen. So if you're keeping those in your system throughout the day, you may have better 24-hour pain relief as opposed to not taking anything and then developing a lot of pain at night. So if you're now one of these people that's having trouble, okay, so what can we do to help your sleep? If you've gotten to that point, now you're having difficulty. So number one for everybody is sleep hygiene. And I really make this an important part of the preoperative education because I want you to start with sleep hygiene before surgery, not after surgery when you're already having trouble. So what is sleep hygiene? So what we're talking about is making sure that you go to bed and you wake up at the same time every day, and trying to actually set an alarm so that you have an early morning wake up period and a bedtime period. And if you're tired, a lot of patients find that they're actually very tired throughout the day after surgery, is if you set a time for a nap, keep it to a minimum, maybe a half hour, 45 minutes, because the problem that people get into is they don't sleep well at night. And then they're tired. So then they take a very long nap the next day. And now you're not tired, so you don't go to bed until later. And it makes this vicious cycle get worse and worse. So really, really try to set prior to surgery a sleep hygiene schedule of wake up time, go to bed time, and a nap time. Now, another few items that actually help that whole idea of sleep hygiene is getting outside early. It's actually been shown that getting outside in the sunlight early in the morning. So I try to tell my patients before 9 a.m., try to get 5 to 10 minutes of sunlight. It turns on your circadian rhythm. And the opposite negative aspect of that is this, is looking at a screen, looking at your computer, looking at your tablet, looking at your phone, looking at a TV within an hour or two of bedtime. So I really try to get all the patients to avoid any screen time for 1 to 2 hours prior to you going to bed. So that's an important thing, is setting the sleep hygiene. Now, one of the other things that may help this, and one of the things that I recommend to my patients, there's a lot of options out there. The one I most commonly recommend is there's an app that you can download called Calm, and Calm actually has a 7 days to sleep. And what it goes through, I wrote down a couple of the titles because in the 7 days, they have, the first one is actually on understanding the challenges of having difficulty sleeping. And also another one is talking about ways to relax the body. So for many reasons, just what we're going through right now, the COVID pandemic, that elevates stress and anxiety, but pain after surgery and stress and anxiety of the surgery can cause difficulty sleeping. So I like patients to actually do this the 7 days prior to surgery. So you have all this information and these tools, and then they also have other things, little like white noise and soundscapes that you can listen to in the background that may help and aid with you getting to sleep. Now, the other thing, the third thing that I recommend to a lot of patients, and I don't really understand exactly why it helps, but it's something that a lot of patients have found to be helpful. I really believe that it has something to do with just distracting your brain, kind of like white noise. So any of the topical agents that you can buy at the pharmacy. So these would be things like Icy Hot, Tiger Balm. I've had some patients have good success with Salon Pause, Bengay, any of the capsaicin style products, something that either has menthol or some capsaicin that causes a little tingling, kind of burning sensation. That, if you put it on the sides of your knee, behind the knee, obviously not directly on the incision after surgery, but a lot of patients have told me that that has helped them get to sleep. And I believe it has something to do with soothing the knee, but also distracting the brain. Now, exercise. This is a hard one because everybody's a little different. So this is going to be one that you're going to have to figure out on your own, is do I do some exercise before I go to bed, or do I try to avoid exercise for a few hours before I go to sleep? Most patients that I have will find that a gentle little bit of range of motion, if they have a stationary bike or pedal machine prior to going to bed, helps. Some patients I have found that they'll say, hey, if I do any exercise within an hour of going to sleep, it makes it worse. So I try to avoid any exercise for 2 hours. That's fine. Next thing, ice or heat. Very commonly after an injury, after surgery, we recommend ice. And I find a lot of patients before bed using ice to really numb the knee will help them get to sleep and stay asleep for longer. Some patients, and again, have had better success with heat. So if your knee's stiff and achy, you might find that the heating pad helps. But those are things that are very simple that you can try if you're having difficulty sleeping. Now, other products, so medicines, and there are some homeopathic. So most commonly, people will talk to you about using things like melatonin. So melatonin you can get over the counter. It comes in some pretty small doses, 2, 3, 5 milligrams. Most of the significant benefits don't really start until about 10 milligrams. So obviously, the least amount that gives you the best effect is helpful. Talk to your doctor just to make sure that it's safe for you with your health history and medications. But melatonin is a product that you can get over the counter, and you may find that that is helpful for you to help, again, reinstate that circadian rhythm and help you get to sleep. Now, as far as medicines, most commonly you'll hear a lot of surgeons like me will say, oh, I don't know, you can't sleep, use Benadryl, it might help you sleep. And it has been very effective for a lot of people that have difficulty sleeping. If you're also using either an acetaminophen product like Tylenol, acetaminophen PM or Tylenol PM is an option. So you might say, I take 2 Tylenol in the morning, 2 in the afternoon, and I take my 2 acetaminophen PM before I go to bed. And the same thing holds true that if you're not on a prescription anti-inflammatory, you can find ibuprofen, which is the generic for Advil and Motrin, in a PM version, which has a little bit of Benadryl mixed in with it, or naproxen, which is Aleve. So this way, you're going through, sleep hygiene, key, making sure that I have all my notes for you. The Icy Hot Bengay Tiger Balm, using the Calm app, and I'll put a link to that in the description for the video. Ice or heat, range of motion, and then the medications. Just understand, having difficulty sleeping is very common, so you're not alone. And for most people, this goes on for about 6 weeks. If you're lucky and you don't get this, that's great. If it goes away in 2 weeks, even better. If it's 8 weeks and you're still having trouble, you're not alone. There are still some people that have trouble a little bit further out, but there are things that you can do that I've listed here that will help you if you're getting stressed, anxious, depressed. It's very common to have some short-term depression after things like surgery and when you deal with pain. So if that happens and if that occurs, talk to your doctor. If it's not something that's short-term and it's something that's going on longer, or possibly you've had a diagnosis of clinical depression prior to surgery, those things may make it even more difficult for you to get a good night's rest. So talk to your doctor. There may be some short-term changes in your medications, or talking to your therapist may also help. But in the end, we all need good sleep to improve our health. And when you're healing from surgery, that is extremely important. So if you're having trouble, use these little tips and tools. We hope they help. There's actually, interestingly, a few studies that are actually coming out, because this is something that we've always known about, but no one's really studied it in depth. So there's a few studies that are going on now in the hopes that we may have a better strict sort of scientific answer to give patients. But in the meantime, these tools should help you get a good night's rest. Until next time, I'm Adam Rosen. Thanks for listening. If you enjoy these topics, look at some of the other videos that are on the site. And if you enjoy podcasts, you can check out my podcast, Your Knee, Your Health, which has a lot of similar topics that you can listen to about your knee and your health. Until next time, stay safe, and thanks for listening.